You see my, you see my screen? Perfect. Thank you so much.
Yes. We can see your screen.
Okay, perfect. So again, hello everyone, and welcome to this webinar on breast health. I'm honored to be invited to this webinar. As Emma introduced me, my name is Shadi, and I'm a breast cancer epidemiologist and cancer epidemiologist by training. I completed my Ph.D. at Karolinska Institute in Sweden, and currently I'm Postdoctoral Associate at Weill Cornell Medicine in New York. So in this presentation, basically, I'm going to present some topics, the state of breast cancer worldwide and also in Finland particularly. One of the things that it's really important that we know what is the state of breast cancer. So let's look at how it looks like in world and also in Finland. So from 2020, breast cancer has become one of the most diagnosed cancer globally, overtaking lung and prostate cancer. Previously, lung cancer was one of the most common cancer in the world. And you can guess what is the reason for reducing lung cancer is that because due to the smoking cessation campaigns that the lung cancer reduced, but unfortunately, breast cancer is on the rise. Breast cancer is the most common cancer in both high and low income countries. Previously, the trend was that we could see a rise in high income countries, in Western countries, but now we see the same trend in low income countries, basically impacting 2.1 million women each year. So this is the data that we have currently. It's 1 in 8 women will get breast cancer during the lifetime. It could become 1 in 7 as the numbers are on the rise. So to get a sense, so we have every 2 minutes a woman is diagnosed with breast cancer in the US. And in Sweden, on average, 1 woman is being diagnosed with breast cancer every hour. So basically, all these data is showing us that the incidence of breast cancer, meaning getting breast cancer, is increasing dramatically around the globe. So let's look at the data from Finland. This is the data that's provided by Finnish Cancer Registry. As you can see also, this as the same places around the globe. In Finland, breast cancer is also the most common cancer among women. And in 2022, 871 women died due to breast cancer. And basically around 5,000 women in Finland are diagnosed with breast cancer. The good thing is that, as we can see, the survival rates, meaning women are living for 5 years after the treatment and after the diagnosis, is 92%, which is really good compared to other cancers. You can see for lung cancer is 23%, for colorectal cancer is 72%. However, the aim of research and all the awareness is to improve that number to 95 or 98% in coming years. So this actually shows that as we have increasing the number of cases, but we are improving in survival rate and decreasing the mortality from breast cancer. So we can look at some of the established risk factors for breast cancer, and we can also learn the ways to prevent breast cancer as much as possible. So we know that there are factors that are known as non-modifiable risk factors. So basically the factors that we cannot change, and those are the difficult ones. For example, being female itself is a risk factor for breast cancer, because we know that breast cancer happens also in men. However, the number is 1 in 100, whereas in women it's 1 in 8. So the incidence is higher in female, and this is due to the specific hormones that we have, estrogen and progesterone, and also the fluctuation and changes of these hormones throughout the female life. We have also age, and increased age is a known risk factor for any cancer. So as we get older, we have increased risk of any kind of cancer, including breast cancer. And the risk of breast cancer increases as the age of 40 and above. And then another factor that is non-modifiable is genetic and having family history of breast cancer. So we know that women who are having mutation in a specific gene, BRCA1 and BRCA2, breast cancer gene 1 and breast cancer gene 2, they have increased risk of breast cancer. It could be from 45 to 85% increased risk of breast cancer. And that's why genetic screening and counseling are also recommended to some women with a strong family history of breast cancer and also ovarian cancer. And I will talk about it because it's an important factor to be aware of. So basically, how do we know that we should be aware, and we know that we might need a genetic counseling or discussing with our primary care provider or a doctor? So there are some factors that we actually should take into account. Usually, if a woman is diagnosed with breast cancer below the age of 50, genetic testing is recommended. However, if you are healthy and you don't have cancer, but it comes to your mind that do I need genetic counseling and testing, so you can take some time and think about these factors. So whether there is a male breast cancer at any age in your family member, especially if it's your father or brother, it's very important factor or sign. And also, if you have a multiple relatives in the same side of the family with breast cancer, particularly if this is your first degree relative, mother, sister, daughter, but it can be also your aunt from your mother's side, aunt from your father's side. It doesn't matter. Some people think that the people who are having breast cancer in the mother's side is more important than your father's side, but it doesn't matter from genetic point of view. So your aunts and family members from your father's side also, if they get the breast cancer, and if the breast cancer or ovarian cancer happen at young age, below the age of 50, it's a factor and a sign that you should maybe think about genetic counseling. And also, if your family member or yourself have a breast cancer and ovarian cancer, because this is also another important marker that those cancers happen and could be related to BRCA gene. And then also, if you are part of the Ashkenazi Jew heritage, that's also strongly recommended for genetic counseling. At least in the US, it's very important that those people have a genetic counseling when they are young. Because we know that they carry the BRCA1 mutation. And whether you know the state of your family history of breast cancer and ovarian cancer, then it affects your screening. So that's why it's very important to know it early on. So as an example of a celebrity, we know that Angelina Jolie, who openly talk about her journey. As you might heard, in 2013, she elected to proceed with prophylactic double mastectomy, meaning removing of the both breasts, and also oophorectomy, meaning she removed also her ovaries after the genetic screening and learning that she had elevated risk of breast cancer and also ovarian cancer due to mutation of the BRCA1 gene. And her grandma died because of breast cancer. So she quoted that my doctor estimated that they had 87% risk of breast cancer and a 50% of ovarian cancer. So this is a sign that there are different levels of screening and prevention method. And one of the prevention method is actually for those people who carry those genes and they have a higher risk of breast cancer is unfortunately double mastectomy or oophorectomy. But this is how life it is, I think, for to prevent breast cancer that is actually causing a lot of mortality and morbidity in women. So let's talk about the modifiable risk factors. So we talked about some non-modifiable risk factors like age, being female, genetic and family history of breast cancer. Those things we cannot change. But there are some lifestyle factors that actually influence our risk of breast cancer. And one of the important one is alcohol consumption. And so research continuously showing that no level of alcohol is safe. That is actually well established now and published in 2018 in WHO. And research is also showing that any level of alcohol can increase the risk of breast cancer, but is particularly showing that women who have 3 alcoholic drinks per week, they have elevated risk of breast cancer, about 15%. So that is very well established and there is no place for a discussion and debate. The other factor is actually smoking. And we know that research also showing that smoking, the current smokers and also those who smoke more than 10 years, they have a 10% higher risk of breast cancer than those women who never smoke. So if you smoke, maybe it's the best time to stop smoking. Those factors, such as alcohol and smoking, there is no place for debate and discussion, and they are well established as risk factors for breast cancer. The other factors is obesity, especially excessive fat tissue around the abdomen and hip area in women. And obesity is known as a risk factor for breast cancer development and recurrence. So women who had breast cancer, they recovered, they got the treatment, is a risk factor for the breast cancer coming back. And we know that the fat tissue, the adipose tissue produce excessive amount of estrogen, which is linked to increased risk of breast cancer. And research is actually showing that obese women, they have higher level of insulin, and we know that insulin is associated with some cancer and also breast cancer. So obesity increase risk of breast cancer by 20 to 60%. The other factors are related to diet and, for example, consumption of ultra-processed food and red meat are associated with risk of breast cancer. And we know that diet, which is a factor for many different cancers, including colon cancer, stomach cancer, is also associated with breast cancer. And if a person is consuming above 10% of ultra-processed food, they have 5% risk of breast cancer. So obesity, diet are also important factors that are modifiable and we can change. One of the important factors to prevent breast cancer is, and it's well known, is physical activity and exercise. And it's strongly now recommended to women who are healthy, but women who are also on breast cancer treatment, who had breast cancer but now recovered and they go back to their normal life. So research is showing that who are actually exercising 4 to 7 hours per week, they have a lower risk of breast cancer by 20 to 30%, which is really great. And WHO is also, so it's a World Health Organization, also recommending 150 minutes as a minimum a week of aerobic training, exercise, and strength training to prevent breast cancer. And finally, even walking is important. So being active is also important. And research is showing that only 30 minutes of walk, fast walk, can lower the risk of breast cancer by 3%. So so since it's summer and it's good weather, so if you haven't been able to be active today, maybe you still have time during the afternoon to take a walk, and maybe a fast walk, and make it as a habit for yourself. So those were there are many different factors for as a risk factor for breast cancer, but I just wanted to briefly mention the most established one, and the ones that actually published on the literature, because there are also a lot of factors that we see on the news, like having dark chocolate or coffee. Those things are kind of like maybe research, or are, for example, interested in a great magazine or newspaper. But the factors that I mentioned are well established, and you can actually start thinking about it. So now we actually look at the structure of the female breast and the sign and symptoms for breast cancer. So as you can see that female breast has different parts. Each part has a specific function. Mostly, I would say it's consists of the fat and adipose tissue. You can see it in the picture in the left side. That's yellow part. It's the fat tissue, and also there are some structures called the stromal tissue that's give the breast structure and the texture. There are also other parts, lobular parts, that actually is the mammary glands. They produce milk. And then also we have the ducts. They carry milk to the nipple. And mostly I would say that breast cancer happens in the lobular or ductal structures. Rarely it happens in fat tissue. So in the right side, we see a picture of a mammogram from the breast, and you will see that the fat tissue, it's translucent, and this is the X-ray image, so it appears as dark, and then the white part is actually the dense part. It consists of the lobular structure and also the ductal structure. As I showed you early, the structure of the breast, we can talk about how we can detect breast cancer early. So early detection is very important, and it means finding the cancer early before it's spread to the lymph node and also the surrounding tissue. Unfortunately, we know that breast cancer cannot be prevented 100%, but by using different tools for early detection, we can provide the greatest possibility for successful treatment. So one primary method for the to detect breast cancer is actually self-examination. And self-examination is basically using fingers to go around the neck area to the chest area, going around the breast, checking the armpits, to the edge of the breast, to the center and below, and also going in circular motion, feeling the nipple, and also up and down, running your hands up and down to see if you will find something. So it's recommended to do it every month after the menstrual cycle, meaning after your period ends and starting the age of 25. And this is very important, and I hope everyone is actually doing this. If you haven't done, starting from this month after your menstrual cycle, because many women actually find their breast cancer themselves during those checkups, and many of them successfully had the treatment and survived. That's why it's very important. This is especially important among young women, because I will talk about the screening, but the screening starts at later age. So this is, and we don't have screening for young women. And we know that breast cancer is increasing among young women, starting from 2020 or 25, unfortunately. So we have only this method to find breast cancer early among young women. And I would say that breast cancer among young women is very aggressive, and because of the nature of the tumor. And I don't go to detail about biology of it, but it's aggressive tumors in young women. So this is very important method to detect the breast cancer early in young women. So when we do the checkup, what we should expect. So if we find a lump on the breast, around the breast area, or under the armpit, or around the neck, it can be painful or it can be painless. It doesn't matter. You should actually discuss it with your healthcare provider. Some women think that if it is not painful, it's not dangerous or it's safe, which is completely wrong. So it can be, breast cancer can be painful and can be painless. Any changes in the breast, in the skin, skin can be, the texture could be changed, the color could be changed, the asymmetry of the breast could change. So if you look at the mirror and you will see that one of the breasts is getting enlarged compared to the other one, which is not your normal breast, then it's also a sign that you should take care of. And if there is a discharge from the nipple, it could be blood or it can be clear fluid. Again, it doesn't matter. You should check it with your healthcare provider, because that's also very important. In addition to all these signs, I would like to show one of the rare type of breast cancer, but it is very aggressive and it's common among young women. So I think it's important to know about the signs and symptoms of this type of breast cancer. It's called inflammatory breast cancer, the signs are could be misleading sometimes, but it's the texture of the skin could change, the asymmetry of the one breast could change, so the other one getting inflated, it's enlarged, you feel itchy around the breast. Again, as I mentioned, the texture of the skin change, and this is one of the important signs. It's a rare type of breast cancer, but it's very aggressive and it's common among young women, unfortunately. So I thought that it's important to mention it's a specific type of breast cancer. And if you find any of these symptoms, you definitely want to discuss it with your healthcare provider. So this is the next step. If you find a lump or other sign that I mentioned, you discuss it with your family doctor, with a healthcare provider, and then they refer you for further investigation. And the further investigation could be mammography, could be MRI, or it could be using an ultrasound to see exactly what's going on inside the tissue. And this is completely based on the doctor's suggestion and recommendation. In the US, based on the recommendation of some doctors, some women actually are sent to the for the ultrasound. So that is very common practice in the US, but I know in some of the European countries it is not. So now we actually we can talk about the gold standard to detect methods to detect breast cancer at early stage. And this is a mammography screening. So in Finland, a mammography screening is started at the age of 50 to 69, and women are invited by receiving a personal letter to take part of the breast cancer screening or mammography every 2 years. In mammography screening, X-ray is used. However, the radiation dosage is very, very minimal. And therefore, there's no risk associated with mammography screening. Some women actually, they scared of X-ray And some of them, they asked me if it's okay to be in that radiation. I would say it's very safe. The new devices are very, very safe. The dosage is very minimal. We are actually in environment, we receive also X-ray. So there is also X-ray in our living room, but and this is also part of the environment. But then it's very safe. It's every 2 years, and it's very minimal dosage. So you should not worry about getting mammography screening. This is actually showing the breast cancer screening in European countries. And it's very interesting that we see that Finland is one of the countries with the very high participation rate, which is great. It's placed second after Denmark. I would say this is one of the reasons that we have a high survival rate among women diagnosed with breast cancer in Finland. So it was above the 90%. It was 92%, which actually reflecting a really good participation rates to screening mammography. I thought it's also interesting to look at, because we always talk about mammography screening, but actually what is a mammogram and how it looks, that could be also interesting. So here you can see a picture of a mammogram, and this is what radiologists see. They would see a lot of information, we could see a part of the chest muscle. It's the pectoral muscle. A big part of the breast is actually a fat tissue. You see it as a black, and then the dense part is a lot of the structures. Could be stromal tissue, it could be the nuclear structure or the ductal structure. So in mammography screening, the radiologist can see invasive breast cancer. You can see it in the left picture that actually, so when you go to mammography screening, there are different type of images that has been taken. There are images that taken from the different angles to the breast, or it could be from above the breast. It's called MLO and CC, and there are some technical information regarding, but there are different images taken from different angles. So we actually see what's going on in the breast, and that's why it's very important. And usually those pictures are compared with the previous year. So if there are changes that the radiologists see, they could report it and they can send you to ultrasound or MRI for further investigation. Beside all the information regarding breast cancer, they could also see the microcalcification. Those are small calcium dots. Some of them could be a sign of common cancer. So that's why some radiologists actually asking for biopsy, because they could be early sign for breast cancer before a tumor that is actually formed. So that's why, again, mammography is very important. Early detection is important. They could also see some other information regarding your arteries, even like if you're at risk of heart diseases, for example. We could see the arterial calcification, so calcification that actually form in your arteries that go into your heart. So we can also kind of like predict who might get cardiovascular issues. So there are a lot of information in a mammogram. And one of the aim of research and my research is to dig into these images and also learn what actually we could see from a mammogram besides just a breast cancer. Based on the research, and I would like to emphasize on mammography screening, because the data is showing us that mammography has helped to reduce breast cancer mortality in the US by 40% since 1990. So as I mentioned, using the information from a mammogram, we can actually predict who gets breast cancer in next coming 5 years. And this is also one of my research projects that I'm interested in. We actually in the US in 2024, the US Task Force recommendation has been updated. So now actually the age of starting mammography changed to 40. It was before 50. And we learned from the literature and the science that breast cancer is happened earlier than 50, and 50 is a long time to wait. So now the recommendation changed from 40 to 74. Some women, they get it every year, and some women get it every second year. And this is very close to Swedish recommendation for a screening. In Sweden, they start at the age of 40 to 74 every second year. One of the things that I also want to mention is that why early detection is important. So when the cancer is actually found early, the stage of 0 to 1, you can see that the survival rate is close to 100%, which is really great. So it means that we treat the person and the person goes back to the normal life and continue to enjoy life. When we detect breast cancer at the stage of 2, the survival rate decreases to 93%. And when we find it in stage 3, and stage 3 means that the cancer is actually spread to the lymph node around the neck or armpit or other part of the breast. So it's not anymore local, but it's expanded. So the survival rate decreases to 72%. And stage 4, it means that the cancer moved to or travel to other part of the body and organs, and that called metastasis. For example, to the bones, to brain, to liver, and that actually reduced the survival dramatically to 22%, and the prognosis is very poor. So early detection is the key, and we can detect breast cancer early on. We can use the breast self-examination every month for women who are younger, and also using the breast cancer screening for women above the age of 40 or 50. My preference based on my research in Sweden is the age of 40. And I hope in some of the European countries, they also change to 40 as the US this year actually changed it, and which is a really great thing. But then there was a lot of debate and fight to change the age from 50 to 40. So I would like to thank the organizers for this webinar, and please contact me for any question regarding this presentation or further question or collaboration. I'm always happy to collaborate and take part in women's health, especially breast health. I'm happy to take questions now or after all the presentations. Thank you.
Thank you so much, Shadi, for that wonderful presentation. Yeah, so since we're running out of time, we kindly ask the participants to prepare their questions, and we could take all the questions at the same time at, probably at the end of the presentations. So thank you so much. So the next person I'm going to call is also a wonderful colleague of mine, Pilvi. Amazing again to be collaborating. So please help me welcome Pilvi Kruanlahti, who is a nurse and also a healthcare specialist at Know Your Health, Tunnarintasi ry. So the floor is yours, Pilvi.
Thank you, Emma. It's wonderful to be here. And I will kind of smoothly continue from what we just heard. So pretty much we are still in the same area, talking about the early detection and how to find the breast cancer early. So as said, I'm from this organization called Tunne Rintasi. So we're a nonprofit organization, and our goal and the key to everything we do is to promote the early detection of breast cancer and of course the healthy lifestyle and hoping that everyone loves their body and wants to take care of it. We strongly believe that when women and men feel confident and happy about their own body, they really want to cherish it. They want to do everything in their power to make it even better and to feel better in their own skins. So this is what we do on a daily basis. And today we are going to talk about those early detection techniques and what goes around it, especially here in Finland. We heard about international point of view and how it's done, for example, in the US, and obviously there's lots of similarities here in Finland as well. And just as a reminder, here are the signs that you are looking for in your breasts. So these are actually quite new pictures. They were published just this week. So as you can see, there are various types of different kind of symptoms, and obviously I don't expect you to remember them all, but whenever you find something that concerns you, you're looking at your breasts or you're feeling them out and you find something that hasn't been there before, it's a sign to get to a doctor so that they can check it and most probably find nothing really concerning there. But the good thing is that you've checked it and then you can be at ease. So anything that's abnormal, something that hasn't been there before. And that's why it is important that every woman would know their own breasts, that they are familiar how they usually feel, how they seem, how they are in your body. And obviously the most common sign is the lump. So that's definitely the most common sign that the person detects themselves. But there could be lots of others, like we heard. So it could be something to do with the skin. So it could be that there is, for example, some kind of a rash that just doesn't heal. It just keeps on being there, even though what lotions or creams you put on it. Or it could be an ulcer, especially under the breast. It could be that there's a sore that just doesn't heal, even no matter what you do with it. Or it could be this kind of orange peel skin. So it really does look like an orange. Obviously, it's not an orange color, but it really does look like an orange skin. So it has these little holes in it. So that's one of the signs. Or then it could be, for example, this kind of thickened tissue. So you can actually, some women have told me that it feels like they have an extra layer of skin under their own skin, so that they can really feel that it's not exactly a lump, but there is something kind of spreading under the skin. It could be that there is this inversion, meaning that the nipple is kind of drawn inside the breast. So you can actually see that before the nipple was pointing out, perky and beautiful, and then suddenly it starts to kind of collapse inside the breast, like there's a string that is pulling the nipple in. Or it could be somewhere else in the breast. It could be that there is this same kind of retraction somewhere in the skin area. It could be that there is only this strange feeling that you have. As we heard, it could be that there is this kind of itching feeling. One woman told me that it felt like there were lots of ants, those little bugs just, running around under the skin. And it was so irritating, and it was strange, the feeling that she had. Or it could be this kind of warm sensation that suddenly the other breast feels warmer than the other, or it could be pain. It's not common, but it could be that you can actually feel some kind of strange pain kind of feeling in the breast. Or it could be this kind of discharge. So there's something coming out of the breast. Obviously, if you're breastfeeding, that's a different story. But if there is something that shouldn't be there, and of course, then that's also a sign to go for a checkup. Or if the size of the breast changes suddenly, and especially if only the other breast grows or it gets somehow other different than it has been before. And all these are the signs for you to get a little worried enough to get to the doctors. It is also good to remember that there are lots of breast cancers that have no previous signs. So when the person gets to the mammogram and they actually take a picture of the breast, they find the symptom there, but the woman herself hasn't felt anything before. So you shouldn't be kind of blaming yourself if it would happen that they find the breast cancer and is found in the mammogram and not before. So in many cases, it is so there is no signs beforehand, or the signs are so odd that it's impossible to tell that they could be related to breast cancer. For example, it could be that the person just feels sick for a really long time, feeling kind of tired and feverish, and it could be a sign of something more serious. It could be that it has already spread around the body. I've treated people who have breast cancer detected because they have had so much bone pain. So that, for example, in the hip area, and when they've been studying it, they have found that actually the cancer has already spread to the bones. So it could be really different, and it's really personal and individual what kind of symptoms you get. But it's good to know that these are the ones that you could look for and could find. The good thing is that when women find something from their breasts, something that makes them worried and makes them get to a doctor's appointment, about 75% of those, they are just benign, and there's nothing to be really worried about. It could be that there are scarring in the breast area for different kind of reasons. It could be that there has been some kind of operation done before and has left some scarring there. It could be a cyst, meaning that there is a little pocket of water, kind of this tissue fluid that is in the breast area. That's really a normal finding. It could be these lipomas, meaning fat lumps. So it could be that there is a kind of fat gathered and forming this kind of lump in your breast. It could be mastopathy, meaning that there is a breast tissue just spread unevenly in the breast area. Some women have it more, so much even that it's impossible for them to really do the self-examination or have the normal mammography done because of there is so much mastopathy in their breasts. So this could be something that could be looked for and found, or it could be this fibroadenoma, meaning that this is this kind of a non-harmful growth in the breast. So there's a lots of things that can be found, and as said, only about 1/4 of the findings are actually something to be really worried about. Obviously, some of these still need treating, but they're not cancers and therefore not lethal in a way. So even if you would find something, it doesn't mean that now you're going to die because of it. Here in Finland, we have these different ways for this early detection. Obviously, it is known that it's a really common disease among women, and that's why we've done everything in our power to try to prevent from women getting sick, and if they do get sick, to find it as early as possible. So that's why we have these screening mammographies, as was told. So every woman between 50 to 69 gets an invitation to those. Then, of course, the self-examination, which is really important. As was said, it's important for younger women, but also for older women, as the screenings take place only once in 2 years. So obviously, you should check your breast even in the meantime. So not just the mammography, but also in between those. And then, of course, doctors and nurses do these examinations. For example, gynecologists do these regularly, but not all. And of course, if you see a gynecologist, let's say once a year or even less, it could be that some of us go there never. So, or you see a nurse every year or every 2 years. Obviously, they don't know your breasts as well as you do. So that's why it's important that you check your breasts yourself as well. I've heard some people saying that their husbands do these checkups, but obviously husbands can change as well. So that's why it is important that you are taking control of your own breasts with your own hands and kind of making sure that you know how they should feel and look like. briefly about the screening mammography, obviously we heard a lot. We saw beautiful pictures of how the breast actually seems. So here in Finland, every 2 years, you get a letter home. So when you're 50 to 69, we are really trying really hard to get it, the age gap, the limits higher and lower so that we could start earlier and stop these screenings further down, even for older people. But well, you probably all heard about the cutbacks, and so it's not probably going to happen in a really near future. But we are still trying to get that done because we know that it would be really important to kind of reach these screenings for younger generations as well, and obviously with the elderly as well, as we know that the age is one of the biggest risk factors for breast cancer. But nowadays it's 50 to 69 the limits. They are free of charge. So when you get the invitation to your house, don't be worried about the payment. It's free of charge. So you just book the time. There's usually under the letter, there's for example, an email address or there's some kind of web address or phone number you can ring. And then you just make the appointment. So you can schedule the time that is best suited for you. And then, of course, when you get there, there will be a nurse telling you how it goes. And obviously, you can always ask from the person you're talking on the phone, for example, when you're making the reservation, they will guide you through the steps. But basically, what it means is that you go to the radiologist department. So, for example, it could be a private company or it could be a public company, depending on where you live. But you get there and they will show you the room where you get your shirt off. So you take your shirt off, obviously, because they are going to take a picture of your breast. So obviously there can't be any clothing. There's a person who's helping you to get settled. If you have any special needs, for example, you prefer that the nurse helping you is a woman, you can always ask for that. Or if you're using a wheelchair or let's say you need a guiding dog to help you through, they will tell you how it's done and they will help you to get settled and feel comfortable in there. Then you just walk to the room with the device and they will put your breast between these two little plates and then they just squeeze the breast. It takes about 10 seconds. Some people say that it hurts a lot, but for most it just feels uncomfortable. And obviously if it hurts so bad that you really can't take it, then of course you say so. The good thing is that it only lasts for the 10 seconds, the really bad squeeze, and then you're over and done with. And then of course they have to do it twice so that they can get a good picture from as many angles as possible. And then you're done. And it will take a few weeks for you to get the response. Of course, if there's something really serious, they will probably hasten the call, but they will tell you how it went. So you will get the replies at home, either by a letter or by a phone call. But either way, you will hear what the results are. And of course, you can find them in Omakanta as well. So in this web page that you log in with all your health information in it. So you can get the results pretty quickly and know what's going on. And of course, sometimes it could be that you need more investigations done. So it could be that they refer you to an ultrasound as well. So of course, there could be some findings that are suspicious and they need to check it more carefully. And then they could use ultrasound for that. In some rare cases, they might use even MRI, so magnetic resonance imaging as well. So that's one possibility. Then they probably take some lab tests. And if, for example, they find a lump in your breast, they will take a little sample of that as well with this needle. So that's not painful either. And then they know what is what. And then they will start the treatment as quickly as possible, usually quite quickly. But that we will hear more from Nancy's point of view. So how this thing went. But anyway, once they find something, it starts immediately and then it really rolls like a charm usually. So that's why the survival rates are really good. People go to these mammographies, they are really interested in taking care of their own breast health. And of course the healthcare system really provides good care for women suffering from cancer. But this is what happens in the screening mammography, and every 2 years. After the age of 69, some women still would like to have their breasts checked, regularly. So they would like to have these mammography screen shots taken every 2 years or even every once a year. Previously, about a decade ago, that was still possible, but nowadays we have a law that prohibits women just, walking into a radiologist department and tell them that I need my breast to be checked. So now you need a doctor's referral for that. And of course, doctors shouldn't be writing those referrals unless there's something that concerns them, something that makes them worried. So it's not that you just walk in and get the x-rays done. That's at least what the law says, but obviously there are doctors who have maybe lower standards, meaning that they are more easily prone to give those referrals, and then there are those who are really strict with the law. So it depends, unfortunately, a bit also about the doctor that you might see. But anyways, they are doing those mammographies after the age of 69 if there is something that needs to be checked. And then the self-examination. So as we heard, it is important for younger women because they are not getting to the screenings until they're 50. But then, of course, even the women who are in the between those who are still in the screening age, obviously they really should check their breasts as well. And after the screening stops, because as said, the age is one of the biggest risk factors. And if the screening stops at 69, you still have lots of years to live. So that's why it's important that you take care of your own breasts as well. When you start the breast self-examination, there's no right age or a wrong age, at least when you should start. So if you have never checked your breasts before, that's okay. Then you start today or tomorrow or day after that. That doesn't really matter. The more important thing is that you get to know how your own breasts feel in a different phases of your menstrual cycle. If you don't have menstrual cycle anymore, meaning that you are not menstruating every month, that's okay as well. And then you just you check the breast for, let's say, 2 weeks. Every night you check how they feel, and then you can start doing it once a month, once in every 6 weeks, whatever feels more comfortable to you. For women who still are menstruating, it might be easier and less painful and less uncomfortable if you do it once a month and about 3 days after the menstruation stops. So then the breasts are usually really soft and easier to handle so that it feels less uncomfortable. Self-examination, it has 2 steps. So first of all, you really just look at your breasts, how they look today. How do they seem? Are they like they were yesterday or the day before or a month before or a year before? What has happened in between? You need a good lighting for that. So for example, bathroom is a really good place to do this. Just before you hop into the shower, you take your shirt off, you stand in front of the mirror, and you just see how your breasts look. First, hands down, then it's a good idea to raise them up so you can actually see how they move on your chest. And then from the sideways as well. If you have heavy breasts, it's a good idea to lift them a bit so you can actually see under the breast as well. And at this point, it's also a good idea to squeeze the nipple just a bit so that you can see if there's any strange discharge coming out of it. So this is kind of the look part. And then the next phase is feeling the breast. And of course, you can do it standing up or lying down. We recommend that you do it lying down because especially if you have a really heavy breast, it might be quite hard to get to the really kind of deep ends to the breast tissue. So it might be easier to get to feel through the whole breast if you're lying down. And again, first you go through the breast with your hand by your side. Then it's a good idea to lift it a bit and then all the way up here, if possible, if your shoulders allow and your other conditions allow. So you raise it up a bit so you can actually feel how the breast moves on your chest. And then you just go through it, whatever feels most comfortable for you. Here I have this little breast that I'm showing it with. So Of course, you can do it in circles if it feels more comfortable, but remember that with flat fingers and it shouldn't be painful, it shouldn't be uncomfortable, but you really should feel how the breast tissue feels under your fingers. So squeeze it not hard, but with determination, I'd say. And round circles around the whole breast, or you can do it as slices. So you can imagine it being a slice, and then you go from one slice to the next, all the way through. So these are, or then you can just, go it with this kind of half moon approach. But the idea is that you go through the whole breast. Also a bit to the side as well. We don't recommend you actually going through your armpits with that particular kind of interest, because it could be that there are these lymph nodes that get swollen if you have allergies, or if you have a sneeze, you have a whatever infection, they tend to swell, and that might cause some unneeded concern. But of course, it's not prohibited. If you want to go through your armpits as well, you may do that as well. But that's not necessary. The more important thing is that you know your chest area and how this area really feels and looks. And of course, if there is any concern, if there is any abnormal change, something that concerns you, something that makes you worried, then of course it's a good idea to talk to a healthcare professional. So either a nurse, doctor, if you have a gynecologist that you're used to going to see, then of course she's the right person to talk to. And after all this, your own findings, then these follow-up procedures go on. In Finland, about 40% of all the cancers, breast cancers, are found in mammography, and 60% are found through self-examination. So that's why it's really important that women are kind of alert with their own breasts. So it really is important, and it doesn't matter what where you come from, or if you've done this before, you can start this anyways. And I highly do recommend that every woman takes this as a part of their healthcare routines. You take care of your skin, you take care of your hair, your nails, your teeth. This is just one little thing to do in addition to all that. From our webpage, tunnerintasi.fi, you can find videos about self-examination. You can find lectures. You can find lots of material. We are now actually renewing our website, so there will be brand new and shiny during fall. But you can find lots of information from there. And of course, if anything comes up, we are more than happy to answer. And if an idea occurs that, well, I would like my friends to hear about this as well, you can always tell them to check here. And of course, if you have some, for example, other organization that you are volunteering for, or regularly visiting, a group of people, we are more than happy to come and talk to them about this topic as well. So please don't hesitate to contact us.
Thank you so much, Pilvi. That was so practical. Thank you so much for that wonderful presentation. Really great presentations from both you and Shadi. The two presentations do really complement each other, and we are super grateful for that. So we will be moving to the, you can hear me, right?
Yes.
Okay, wonderful. So we will be moving to the next item on the program, which is to hear from a breast cancer survivor